I was wrong. I am not too big of a nurse to admit that sometimes I am wrong. In fact, I'm a mom to teenagers, so I'm proven that I am wrong all the time. But today I want to share a few things that I used to believe, both as a mom and as a labor nurse, that I ended up changing my mind about. And I wonder if you believe some of these things, and I'm excited to share them with you. And yes, these are things that I've seen after my 20 years in labor and delivery, plus being a nurse since 1997 and being a mom since 2001. It's just stuff I have a lot of history about, so I'm glad that you're here learning from an expert. Okay, this first one I'm kind of ashamed about because I believed for a long time that elective inductions were bad. In fact, if you've watched my video about my own induction, I cried and cried before my induction because I, as a labor and delivery nurse, just really thought we were forcing things that probably didn't need to happen. Obviously, I was fine if there was a real medical reason, but otherwise people should just let nature take its course. But honestly, after talking to more moms, seeing the Arrive trial, I know that people think it's controversial, but the Arrive trial at least showed us that an elective induction at 39 weeks is safe. Possibly safer, possibly more interventions, definitely longer, but it did show us that it is safe. And because it has been proven that it is safe, I think people should be able to choose an elective induction at 39 weeks for whatever reason they want without any of our judgment. And I see online all the time that people should not be able to choose to have an elective induction. It just shouldn't even be an option. And I'm here to say that you are an adult. You made an adult choice to have a baby, and you should be able to make the choice to have that baby for whatever reason you want. Maybe you're uncomfortable. Maybe your mom can only be in town 1 week. Maybe your spouse has something that they need to do. Whatever the reason, if you are 39 weeks, get induced. I don't care. Do it. I'm just kind of ashamed that I ever felt like that was a choice we should take away from women, but the Arrive trial really changed my mind. Now, should we be forcing people to have an induction at 39 weeks? Absolutely not. If your provider is offering an induction at 39 weeks, I actually have an induction checklist that I'll link down below that can be really helpful for you to decide if it's the right choice for you. And I am so glad that we have lots of choices because I think that's really important. Okay, the next one is that oxytocin and Pitocin are the same thing. In case you don't know the difference, oxytocin is made in our bodies. Hillary is making it right now. A lot of people call it the love hormone. It's what we get when we fall in love. We have lots of it surrounding the baby. It's a great hormone when you're not going into labor. Pitocin is the synthetic version of that. Now, if you were able to look at molecules, I don't even know how people do that, even after all the chemistry that I had, they look exactly the same. Sure, in Pitocin, there are some stabilizers that go in there to make sure that, it can live in a container. But essentially, the chemical makeup is exactly the same between those two things. And after my buckets of chemistry in college, I knew that the uterus cannot tell the difference between synthetic oxytocin and regular homemade oxytocin because it's just looking for the specific chemical makeup. And it's kind of like a puzzle piece. When it fits in to the receptor that your uterus has, it's like, okay, that's oxytocin. It's time to start contracting. Now, they are essentially the same, but oxytocin is made in our brains. I think it's made in the hypothalamus, which means it can surround our brains. However, Pitocin, the one that we make, cannot get to our brain. We have something called the blood-brain barrier that prevents certain types of things from getting to our brain, which is really important because brains are very important. I hope you'll agree. But Pitocin is able to bathe our brain with those feel-good hormones. Now, I really think that this matters in the beginning. When you're at home, you can have some of those feel-good hormones in your brain in addition to going into labor. Do I think that that matters so much when you get into active labor? I don't. I think your uterus contracting kind of like takes over all of those different things. The other thing that I knew all along is that we increase Pitocin far more rapidly than your brain creates at your hypothalamus. And so, I like to start my Pitocin at 1 milliunit per minute, which is about 1 drip in a half an hour. And then the next time I do 2, but a lot of nurses started at 2 milliunits per minute and then go to 4. So, we're just ramping it up much, much quicker. And this is a time where I can remind you that you are in charge of your Pitocin drip. Okay. If you feel like the contractions are coming too hard or too fast, you can tell them, hey, can we not up it this half an hour? I'd like to, get some coping mechanisms under my belt. Of course, you have to balance that with the fact that you've asked to be induced. And so we're doing our job, which is increasing the Pitocin. So that's something to think about. But I think a lot of people don't know that they can say, hey, I think that's enough Pitocin. We good for now. Especially if those contractions are every 2 to 3 minutes. That's a good pattern. But I will say that there are some doctors who still want it increased. So remember, you're in charge, not your doctor, even though it gets a little dicey in the hospital. Remember, you're in charge. And if you love pro tips like you are in charge of the Pitocin drip, you might want to check out the online prenatal class for couples. It helps you really prepare for birth and give you kind of a look behind the curtain to see what you can really do in the labor room. I'm going to link it down below. Okay, here's one that I believed for a really long time. And it was just like myth. Like I'd heard it from so many people. In fact, men in my life, which right? The myth that I used to believe is that the epidural would cause long-term back pain. This is because there's lots of moms out there who say I have back pain after having a baby and I got an epidural, so it has to be from the epidural. But there is a study that was done that compared moms who did get an epidural with moms who did not get an epidural. And after that initial bruising phase, which you're going to have anytime we puncture your skin, you're also going to have it with your IV. There was no difference in the back pain between those who got an epidural and those who did not get an epidural. I really don't think that epidurals in general, when done correctly, there are always risks to an epidural where they can harm a structure in there, but it is very rare. But when they are done correctly, I do not believe that they cause back pain. What I do believe causes back pain is carrying a watermelon in front of your body for 9 months and then pushing that watermelon out of your body. Plus being in a lot of pain. I got to say, when I had my appendix rupture, I actually had to go to physical therapy after I had healed because my back was so jacked up because I had been in so much pain for so long. Because of course, I'm a labor and delivery nurse and wouldn't go to the ER, but that's another story. But, labor being a lot of pain, we just scrunch our backs up in so many weird ways. And then we're also taking care of a baby. So we're hauling that dreaded car seat around. We're bending over to put the baby in the crib. And a lot of times people end up doing really poor posture moves to latch the baby on, which I absolutely do not recommend. So I really feel like that we combine all of these things. First off, everyone should be getting a physical therapy appointment after they have a baby, just for them to check out your body, give you exercises that can help strengthen and tone that area and just make you more comfortable. I don't know why it's not a standard of care in the United States, but I don't believe epidurals cause back pain, but I do believe that pregnancy, having a baby, all of those things cause back pain. So myth broken. And I gotta say, myths, especially like that one about back pain, get repeated so often, a lot of us end up just believing that they are true. And I got to tell you that there's probably a lot of things that you believe about birth because you've heard it so much on social media or just from friends and you think that they're true, but they really are not. So I recommend everyone get prepared with an expert. The online prenatal class for couples is the class that I recommend. I'm going to link it down below, but it is taught by an expert so that you really know the truth as you go into your labor. Okay, this is the one I'm most embarrassed about, but Hillary for a long time did not believe that we needed a national maternity leave program. Hillary, back in the day when I had my first baby, did not get maternity leave. I had saved enough sick days because I didn't accrue many sick days in general, but I had accrued enough to be able to pay my insurance while I was on my 5-week maternity leave. But after that, I needed to come back so that I could go back to work and make money. At the time, I worked in a nursing home. I went back at 5 weeks postpartum after a 4th-degree tear, and I was so miserable on my feet all day. I just thought my uterus was gonna fall out and roll down the hall of the nursing home. And somehow I just believed that that's what we should do. We should each be saving up according to our own means and then using that for our maternity leave. However, when I had my second and third babies, I lived in California. So with my second baby, I got 6 weeks paid leave. And then with my third baby, I actually got 12 weeks of paid leave, which I actually ended up splitting. So I went back at 6 weeks and then it was summer. So my husband was home and he did the baby for 6 weeks. And then I took the next 6 weeks when he went back to school. So I saw how a maternity leave just helps so much relax compared to the first time around when we were literally counting pennies, had to go on WIC, all those different kinds of things. And now I am a firm believer that we need a national maternity leave program. There are states like California who are starting their own maternity leave programs. Honestly, at this point in time, I think that's the only way that it's going to end up being a thing. But I am now a staunch believer that maternity leave would make the United States a better place. I feel bad that I ever felt the other way, but I was young. I changed my mind. Hopefully you can change your mind as well. And as mothers, even though we didn't get something, we gotta fight for the new moms so that they get the thing that we wish we had had. And that was a lesson I needed to learn. The next one is that birth classes don't make a difference. And I gotta tell you, my first hospital, I could count on one hand the number of people who had taken a birth class. Most of them did not speak English. We offered some classes in other languages, but we had so many languages at our hospital, it would have been difficult to cover all of them. And most people just did not take a birth class. And I just thought, they come in, they have their baby, so be it. But the longer I did it, the more I saw people who did take a birth class. More people started taking them as I switched to different hospitals. I saw that it started to make a difference. And then I taught birth classes for my hospital. And I started to have the students that I taught the birth classes for, or I would see them across the hall and my friend would have them. And I started to realize what a huge difference taking a birth class can mean towards your birth. I saw with my two eyes that these people did not have to be overwhelmed by all the decisions they made in labor because it was things that we had talked about in advance. I saw how much easier it was for them to make choices instead of being bullied by the healthcare system, mostly because they knew making choices was an option. And then I saw how much better they transitioned into their postpartum life because they knew what to expect. And so many people go into postpartum with expectations that are nowhere near what is going to happen. And after that, I started reading the studies. Birth classes decrease C-sections, they decrease inductions, they decrease the need for forceps or vacuums, they decrease tearing, and they increase birth satisfaction. Birth classes decrease birth trauma, and they can be very helpful. So as I grew and matured, I realized how important birth classes are. And I got to tell you that I feel like now that we've made birth classes even easier to do, even less people are taking them because they think they can just watch, some social media, often leaving their partner behind. But I'm here to tell you, you need a beginning to end birth class. Again, the one I recommend, I'll link down below. The last one, which you're going to be shocked if you followed me for a long time, is that for a long time, I felt like kick counts were useless. And there really are studies that show that 10 kicks in 2 hours or 10 kicks a day. Like, I hear so many crazy things online about what people have said about fetal movement to their patients. The new standard of care is how long it takes your baby to give you 10 movements, because we are just tracking your baby. We're not tracking your friend's baby down the street. We're not tracking previous pregnancies, because all of those are going to be different. Your placental placement can be different. Where baby is facing in the womb can be different. And just baby's activity level. We all know that different people move different ways. You're going to start doing them at about 27 or 28 weeks. And the reason that I changed my mind on this is that I read a study that it decreases stillbirths by 33%. That is 1 in 3 stillbirths that we wouldn't have to have happen if people did kick counts in that way. So if your provider is telling you 10 movements in 2 hours or 6 movements in an hour, I don't know where people get these. They are not evidence-based. I will put a video for you guys to watch about it down below, or you can always check out the Count the Kicks website. They have tons of information on there, and they also have an app that you can do it. It really changed my mind about how important kick counts are. And in fact, it's become a huge soapbox of mine. So that's another lie that I believed. But I've changed my ways. Everything's different now. Oh, I also have a kick count cheat sheet. If you're just like, I want a one and done sheet, I'm going to link that one down below too, so that you can know how to do them at home. So those are the lies that I believe, but I actually see a lot of patients making mistakes. I'm going to link some of the biggest mistakes that I see here. Now, those are the lies that I believed, but I think there are a few others that came up as I was filming this. So if you're interested in a part 2, let me know. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.